Dr. Victoria here, Low-Carb Denver 2020, and I've got Dr. Stephen Riggs with me, who's a pediatric and internal medicine specialist from Iowa. So Stephen, tell me how your low-carb journey started.
Oh wow, well it actually began with my wife. So my wife wanted to become a health coach a couple years ago. I said, go ahead, knock yourself out, that'd be fine, you know. So she did, and then she ran across this book called The Obesity Code. You might have heard of it by Jason Fung. Right, exactly. So I'm reading the book, and I'm kind of skeptical. It's the Obesity Code, like somebody's had a code for obesity, and I knew that was ridiculous, you know, because I've never had any luck in reducing anybody's weight before. But I'm reading it, and I see it's a low-carb approach, and people are losing weight, but everybody loses weight on their diet books, right? And so then he said something that really caught my eye, and that was that he was talking about diabetics, like reversing their diabetes, like coming off their insulin. I was like, no, that doesn't happen. My first 30 years of practice, I'll be honest with you, I never took anybody off their insulin or rarely reduced their medications unless they had like gastric bypass surgery or something pretty drastic like that. So I thought that's testable. So I grabbed a couple of my patients, I tried it out, and bam, it worked. And that's when my world flipped upside down. Wow. Totally. So that I said, okay, I've got to dive into this. So I started using it more and more. I did a deep dive in the literature. Is it safe? Is it effective? Of course, the answer is yes and yes. And I was like, why have we not heard about this before? And then it kind of opened up the whole low-carb universe for me.
And so what year was that?
That was just about 2.5 years ago.
Okay.
Yeah.
And so when did you kind of make it your daily practice at work?
So it kind of gradually evolved, I'd say, you know, so I started with just my own patients and started using it more and more. I see a lot of diabetics, and obesity obviously is a big problem in the country. Iowa's up there about 40% obesity rate. A
lot of corn there.
Corn-fed Iowans, yeah, you can imagine what happens. So we used it a lot there and started seeing more and more success. And as I learned more and more about it and seeing the clinical applications for the host of the metabolic syndrome, I started seeing it. And then I started getting consultations, started talking to our medical staff and getting referrals, and it just kind of has grown from there to kind of a metabolic clinic now.
And so do you work by yourself, or are you in a clinic with other physicians?
So I'm in a multi-specialty clinic, and then my own little house where we're at is about 5 physicians there, a pediatrician, 3 other family practice docs, and myself.
And how well received are you?
Well, good. They were a little skeptical at first, you know, and stuff, but they kept seeing my patients, like, you know, actually reversing their diabetes, losing weight and everything. And then one of them tried it. He himself has been doing it. And he was a little overweight and everything. And then he went on it and lost weight, of course. And the biggest thing he noticed is he's just not hungry. In fact, the other day he told me, you know, I'm just going to go and see how long until I turn hungry, and 3 days later he ate, you know. And he said, for me, that's phenomenal, because he said he was the kind of guy who would have to stop in the middle of his workout to down a bunch of Oreos and cookies and other things just to keep his blood sugar up, but not anymore.
So tell me, are you seeing more kids or adults?
So I do roughly 50-50, but in terms of the low-carb approach, it's mostly adults.
Okay.
But I am doing a lot with childhood obesity. And so and we have a huge problem with that. I mean, we're having fat babies, you know, that's a big problem. So working with our OBGYNs with the pregnancy, prenatal care, and then with children is a big component of what we're doing.
And have you been to a low-carb conference before?
Yeah, I came to Low-Carb Denver last year. It was my first time. And then this year.
That's great.
Yeah, it's been fantastic.
And what are the key points that you've learned so far here?
Wow, you know, so many things have come up in these low-carb conferences. It just is mind-blowing, you know. The applications of low-carb throughout the entire spectrum of metabolic disease, not just obesity and diabetes, but cancer, you know, is a huge area. Things from PCOS to a lot of the mental health disorders, a lot of neurologic disorders. The brain seems particularly susceptible to inflammation, which Low carb improves dramatically, as you know. So seen a lot of that application actually in my practice. So just a pain reduction.
Yeah.
I've had patients, the other day I had a woman I was seeing for a pre-op physical for a knee replacement, little old lady, you know, and she comes in and she goes, yeah, I don't think I need my knee replaced anymore after being on keto for a month. You know, I said, well, think about all the hard work your orthopedic surgeon did here, so I think you should go ahead with it. But, you know, she goes, well, okay, but I'm not going to do the other knee. I said, okay.
And in your practice, have you set your own sort of program, or are you feeding off other information?
Well, I certainly have, like Newton said, standing on the shoulders of giants, right? And so everybody here at Low Carb, I basically have not an original thought in my body, but I steal everybody's ideas and then apply them.
You probably tweak it every now and then.
Yeah, I tweak it a little bit. And so we've, actually my health coach wife, you know, who got me involved in this to begin with, we've created a program, because what I found is that I give a little spiel about the ketogenic diet to my patients, and I have a handout, which I've created. I would say about 20% of the people run with it who do that. They come back in a month, they're feeling great, they're losing weight and everything. 80% don't. And I think it's just too big of a 180, right? It's just too big of a change for them. A lot of why barriers, a lot of how barriers. And so we kind of created what we're calling an 8-week low-carb boot camp, basically. So it's a pretty intensive, kind of like this conference. So I take a lot of the stuff that I've learned from Ivor and Jeff and, you know, Dr. Lustig and all these people, right? And package it in my own words, and then every week I give kind of a talk on the ketogenic diet. And then my wife does a practical how-tos, how do you implement this? And then it's kind of a lab. So we do the ketogenic diet together, we practice intermittent fasting, time-restricted eating. We give them a SMART scale, so they're checking their biometrics, and they can forward that information to us, and then we give them a ketone analyzer so that they're checking their serum ketones. So they're forwarding that information to the health coaches. I now have 3 health coaches who work with me and a nutritionist.
Wow,
yeah,
gosh, it's getting big.
Yeah, and actually we just now got approval for one of our mental health providers is going to Bitten Johnson and is getting certified as a sugar addiction specialist. So there's only a handful of those people, and we're going to have one in my little hospital in Iowa. So it's really exciting.
That's amazing. And is there a peer support network for the people that are on the boot camp? I mean, do they interact with each other?
Yeah, so a big part of that is a component where we do like a support groups together face-to-face. We have, you know, a Facebook grouping, things like that. We have different avenues by which they can get together. We do some cooking together, share recipes, ideas, things like that.
Oh, that's so good.
Yeah, it's been fun.
Yeah. Is there any particular patient recently that you want to tell me about?
Wow, so many. I mean, I just so we just finished up an 8-week low carb boot camp that we were doing. We usually have about 70 people who take it at a time.
Wow.
Yeah,
Gosh.
yeah. So we had the last boot camp we did. We had about 54 people, and then that I have stats back on. And we had 15 type 2 diabetics. 5 of them didn't know they had diabetes. So we checked labs before and after the boot camp. We picked up 5 new diabetics, like with A1Cs of 8.7.
Oh gosh.
And they were on various medications and whatnot. At the end of the boot camp, 8 weeks, nobody had diabetes anymore.
Amazing.
Yeah, you're not even supposed to check an A1C that quickly, right? But I do anyway.
Yeah.
And they're all under 6.5. No one's on any medication except for maybe some with metformin. This last boot camp, I had a woman who was on 100 units of Lantus, and she's on no Lantus in
incredible.
8 weeks. I did a little cost analysis on that. You know, 100 units of Lantus a day in the States is about $900 a month, and that's just crazy.
That's a lot of holidays.
Yeah, that's insane. So that happens every day. And I tell you one thing, it's brought the joy back to medicine for me. I've been in practice for 32, almost 33 years. And I was happy, I mean, doing my thing, but this is unbelievable.
Yeah, don't you reflect back at the the sort of lack of purpose and helplessness that you had?
Totally. I feel like I need to apologize to my patients for the first 30 years of practice, basically. I mean, it's sad.
Yeah, it is. Well, look, thank you so much for talking today.
Yeah, thank you.
And I'll let you get back to Low Carb Denver.
I appreciate it. Thank you.
Okay.